Thanks for speaking to us today, Mister. Just to begin with, obviously our conference today is all about mental health and poverty. I mean, how closely is poverty and mental health linked in Wales? And is it more prevalent in deprived areas, would you say?
Yes, we know there are a whole range of studies and objective evidence that confirm that if you're poor, then you're more likely to suffer from mental health problems. For example, if you're in the least well-off fifth of the population, you're more than twice as likely to suffer mental health illness as you are if you're in the wealthiest fifth. So the link is very clear, and we recognise that in a range of government action and intervention programmes. The way that Families First, Flying Start and Communities First, and I'm directly responsible for work, there's a range of those measures that recognise that people who are living in poverty are more likely to have extra barriers around confidence, around potential stresses in their life that they need to get over and have help with to allow them to engage more effectively. And a number of those are low-level mental health problems, some of them are more significant. So there's a clear recognition of that there's a very definite link between mental health and poverty.
And of course there's recognition of this in the action plan.
That's right. The Tackling Poverty Action Plan, which is my primary responsibility in government, brings together all of the different parts of the government into one coherent plan to try and tackle poverty right across Wales. That obviously includes helping people who do suffer from mental ill health. Now, we have the Together for Mental Health strategy. It's a 10-year plan, as you know. It's only in its second year, but it's referenced in that plan. What's particularly important is that all of the different interventions that seeks to bring together work most effectively in our poorest communities, because, as I said earlier, that's where we recognise the greatest need is and the greatest likelihood of people suffering from mental ill health exists.
Of course, as part of this, it's vital that services are linked together and work in tandem rather than in silos.
That's a theme right across mental health provision, and also across a whole range of government activity where we do need different partners to work with each other. In this field, you've obviously got the health service and the different parts of community, primary and secondary healthcare that need to be more effectively joined up. But we also recognise there are partnerships with local government, with third sector groups, and most importantly, of course, with service users and their carers. And what's important about the Together for Mental Health strategy is that there's a recognition that service users and their carers need to be involved and have a meaningful say in helping to design interventions around them. So things aren't being done to them, but they're done with them and for them. And that's really important, because if you're going to help someone in a meaningful way, then they should really have a stake in the outcome. And after all, improving outcomes is what we're here for. So 2 years in to a 10-year strategy, but I'm looking forward to seeing what the outcomes are as we progress, to see if the improvements that we think this will bring will actually be delivered.
And of course, another facet of poverty often is welfare. A lot of people in poverty also on welfare benefits. Of course, there's the welfare reform agenda. So what is the Welsh Government doing to offset the impact of that for people with mental ill health?
I think it's important at the outset to make clear again that the Welsh Government has huge concern about and does not support major planks of the UK Government's welfare reform agenda. We recognise that the least well-off fifth of the population are going to be the hardest hit from all of the tax and benefit interventions. We recognise that people with a range of disabilities will also be amongst the hardest hit cohort as a direct result of the policy choices that are being made. And so that underscores we have a real disagreement on the values that underpin welfare reform, but we also have real concern about the competence that comes around this. You'll be aware that a range of challenges have been successfully made around the programme as it's been issued. We'll be aware that Universal Credit is behind time, and that's largely because of the design and the efficacy and competence in rolling that out. So we do recognise that people with mental ill health are within that hardest hit group of people. In Wales, we recognise that access to advice is often one of the most important things, because a range of people need support to navigate their way through the benefit system and to understand the changes that are being made. One of the big anxieties people have is when changes are made, whether they affect them, the time they have to adapt their circumstances. And for some people, of course, the adaptation that they have to make is to manage with less money. And if you're already in the poorest fifth, then you then have less to manage with. That understandably brings extra stresses. Now, last year, the Minister for Communities and Tackling Poverty made an extra £1 million available for advice services. There's ongoing engagement with the advice sector here in Wales for independent, high quality advice, and in particular advice around benefits and debt.
Yeah.
And with the Better Advice, Better Lives project, we think that we've levered in an extra £16 million in benefits for people. So there is real practical action that we're taking to try and mitigate the impact of welfare reform, as well as a very clear difference in values about what is underpinning the UK government's deliberate choice with tax and benefit reform.